Good morning. So, I think I look back over the last 26 years of my life and my career as an endocrinologist. And I'd like to reflect on the fact that there's been so much change in the specialty and the subject in itself. If you look back, way back into 1993, 1994, the clinical aspects of endocrinology were so strong in terms of trying to make a diagnosis of a particular disorder without using a biochemical test. For instance, I remember a parathyroid hormone might take about a month. A growth hormone assay may take about 6 months to get ready. And thyroid function tests may take about a week. So you really had to depend on your clinical skills in certain situations to make a diagnosis. You may have had patients who were fairly ill and who may need, in fact, parathyroid surgery, but you couldn't wait for that long. And so therefore, depending on your clinical skills, a few critical biochemical tests was so important. You had patients who had florid Cushing's disease. You had a first generation MRI scan which you might pick up a pituitary tumor, but you may not. And on the other hand, you may have had patients with entire negative CT scans of the abdomen, negative MRI, and you had to think about localizing the tumor, but you couldn't. You had biochemical tests, and then you'd start the patient on medical treatment for Cushing's without knowing where the origin was. We didn't have PET scans those days. So the entire gestation period from seeing the patient clinically, doing biochemical tests may have been maybe even a couple of weeks or 3 weeks, and your treatment might have been empirical. And over a period of time, maybe months or years, the tumor would evolve and come to you, and then you'd make a diagnosis. So this is the scenario. If you actually look back, and perhaps if you were not working in that particular era, you might think we were primitive. I don't think we were primitive. I think we just had to use our clinical skills a lot more at that time. Now we are in an era where you can get most hormonal tests within 24 hours. You have imaging which is so comprehensive, and you can pick up many diseases or disorders quite early. And the time period to make a diagnosis may be a week or at max 10 days in the most difficult situations. However, I still think the core values of being a good endocrinologist, and perhaps any major specialty, whether it's nephrology, endocrinology, infectious disease, rheumatology, is you have to be a good physician. Your bedside skills are still so important over here. You should not be thought about as a hormonologist. You should be thought about as an endocrinologist or a physician who has an interest in endocrinology. Spending time with your patients, taking a good, proper history which is lengthy, is still the key. Re-examining your patient on several occasions is very important. And that's how you make a diagnosis. So, the core values as a physician are certainly very important, and that goes on to the next point, which is endocrine training per se. So, endocrine training per se starts with a basic foundation of strong general medicine. You haven't got a strong foundation of general medicine, then you can't move to the next step and become a good endocrinologist. It's so very important. When you go through the process of training in endocrinology, it has to be comprehensive because there are so many systems involved, and your interaction with multiple specialities is also so critical. So that interpersonal relationship with other specialties during the process of training should continue thereafter once you become a full-fledged endocrinologist. For instance, you may work with a person who has got competency in doing thyroid surgery, thyroid malignancy, and therefore you need to interact with the endocrine surgeon before surgery, after surgery, and subsequently on a long-term basis as well. You cannot solely manage the patient on your own. You have to depend on a team. Similarly, your relationship with the neurosurgeon is so critical when you're dealing with a pituitary tumor. And therefore, one of the most important things as an endocrinologist is building up multiple relationships and multiple teams. Take, for instance, diabetes. There is no way that you can handle any chronic disease by yourself. It's the core important thing. In non-communicable disease, you need teams. You need a diabetes educator, whether that's a dietitian or a nurse, that's up to you. You need someone who can help you with foot care. You need a process for offloading, therefore you need to have an orthotist or a prosthetist, a physiotherapist to help you getting a patient who has had an ulcer to walk again or have proper footwear. So it's all about developing multiple teams on a long-term basis. And that skill should be imbibed during those 3 years of core endocrine training, which is as important as your clinical skills, your theoretical endocrine knowledge. It's all about teamwork. So, during my talk this morning, what I tried to emphasize is the fact that when we deal with patients with diabetes who are relatively young, perhaps less than 35 or less than 30 years, we need to have a very broad differential diagnosis. It's not just type 1 or type 2. Beyond that, the investigations need to be comprehensive. So when you have a person who has young onset diabetes with a very strong family history, we need to think of genetic disorders. One of them being maturity onset diabetes of the young. But that's just one. And there are many other undifferentiated forms of young onset diabetes which are there. And currently with technology which has evolved over the last 5 to 6 years, we have this technique called next generation sequencing or NGS. And what next generation sequencing can do is you can line up to 30 to 40 genes at the same time, of course with good technology and a good scientist, and try and make a diagnosis of a single mutation or a double mutation in a particular condition. What NGS has done is that it's been able to cut down the cost in making diagnoses of certain disorders almost 200-fold. So something which would have cost something like maybe 1.5 lakhs for 3 genes will today cost something like 12 or 13,000 rupees for 35 genes. The turnaround time and the throughput is much more rapid. You can get an answer within about a month. But once again, let me emphasize, it's all about not just technology, it's about good scientific brains, and it's also all about a good family history, a good pedigree chart, and a good interaction between the scientist and the clinician. The second part of my talk was all about mechanisms of diseases like fibrocalcitic pancreatic diabetes. And what is surprising, it might seem evident, and it is true that insulin deficiency is common and is a major factor in the evolution of the disease. But what came as a big surprise was that they do have excessive glucagon production. And we really don't know the reason for this. We are continuing investigations in this particular area to figure out what's happening. We have one particular category of lean diabetes, what was called malnutrition modulated diabetes about 2 decades back. It was on the WHO classification. It's no longer there, it's been taken off, but it still very much exists in lower socioeconomic classes and rural areas of India. What the founding fathers of this particular condition thought was that it's largely an insulin resistant condition. In our group, we have found out quite clearly that it has an association with strong insulin deficiency. There is insulin resistance at the level of the liver and also some peripheral resistance in addition, but it's largely that of insulin deficiency. So let's put all these things together and we say that when you see a person who is young with diabetes, do a few simple tests. You need to get a very good pedigree chart and a very strong family history. Look for dysmorphic features. Take an ultrasound of the abdomen or a CT scan to look for calcification in the pancreas. Measure C-peptide levels in the fasting and the postprandial state. And in addition to that, if you have any doubts in terms of a potential genetic testing, then you should resort to referring those samples to a center which has the capacity to do next generation sequencing. Thank you.
Hello, I'm Dr. Kalyan Kumar Gangopadhyay. I'm an endocrinologist in Fortis and Peerless Hospital, Kolkata. And I've come quite late to this conference where I'm very, very pleasantly surprised by the volume of presentations, the data being presented, and new research and new things which are there in the field of endocrinology. As you all know, endocrinology means hair on top of your head to the nail in your feet. So it encompasses everything. And every doctor must have some knowledge of endocrinology, otherwise he is not a complete doctor. And as far as the general public is concerned, they must have some idea about what exactly is the field of endocrinology, and that's what ESICON here has told us. So the ESICON 2018 is here in Bhubaneswar, great venue and great audience, great halls and good scientific content. Now the contents which I liked particularly were the short 10 minutes bursts of endocrinology snippets which was presented. I liked it because sometimes the talks can get a bit more laborious, a bit longer, but here in 10 minutes we have got burning issues which are not addressed in most of the conferences because they are not that long to be included in a 30-minute talk. So here what they've done is they've concised it and put in 10 minutes, so you don't have time to get bored. It's an excellent 10-minute talk of the common problems in endocrinology that we endocrinologists, and not only endocrinologists, the physicians, the general practitioners, everybody who practices medicine need to know. And that was addressed in short 10-minute bursts, and I like that quite a bit. Especially about congenital adrenal hyperplasia and how to adjust the steroid doses, hypoparathyroidism, calcium replacement in hypoparathyroidism, and etc. My talk was about the newer basal insulins which have come in the market, and I showed in detail about the PK/PD data. I went into detail about the PK/PD, meaning pharmacokinetic and pharmacodynamic data, because that is very confusing for many of the delegates, and I showed how I simplified it so that everybody understands exactly what you mean by PK/PD data when you compare two basal insulins. And here I also showed the BRIGHT study, and where we compare the two newer insulins, insulin degludec and glargine U300. I think overall the ESICON always stimulates the doctor in me, it stimulates the child in me, and it stimulates most of all the endocrinologist in me. And the ESICON is not only for the endocrinologists or the diabetologists, it is for the general practitioners, it is for the physicians, it is for the gynecologists, it is for everybody. So I think ESICON should grow every year in size, and so that everybody can put their input and make this conference even better success. So with that, I end. Thank you very much.
Namaskar, myself Dr. Abhay Kumar Sahu, Organizing Secretary, ESICON 2018. In this ESICON, which was from 15 to 18, today is the last day of the conference. In this conference, we have registered 2,600 delegates, which is for ESICON, it is the highest number of participants across and those participants not only from our place, it is across India, and I will tell it is across the globe, because in this conference almost 89 outside delegates have participated in our conference. And another biggest highlight is we have our Odisha Medical Council has given us 16 credit points, which is for a single conference, it is one of the highest credit point what we have got in this conference. Thank you.
So, good morning everyone. I am Dr. Sambit Das. I am the Scientific Secretary ESICON 2018. I think we have met the expectations of ESICON 2018. It was an ESICON with 4 days, 4 halls and 174 hours of academics activities, and few important or the few newer things we tried to do, and we have included maximum number of faculties as 300 national faculties and 22 international faculties. Those were actually the authorities of their subject. Few of the highlights of this ESICON was that the day 0, that's the 15th of November, was devoted completely to the DM trainee students, and you all might have enjoyed the Endocrine Premier League, which is a debate of 8 topics of diabetes and endocrinology. Then there was a meta-analysis, mastering meta-analysis by IJM, and that was actually beneficial to the students and to the faculties also. Other highlights of the scientific part of the ESICON was Make in India symposium, which the endocrinologists in India who have done actual work or the devoted work in a particular field in endocrinology have been highlighted in their topic, and they were given a special reference as Make in India. And there were few unanswered questions and questionable answers session also has been placed for day 4 of the program. Apart from that, we have 3 endocrine panchayats where there was a sarpanch and 6 to 8 panelists were there, and they had discussed some of the contemporary or controversial issues in endocrinology. I think we had tried our best to do the best scientific program this year. Thank you.
Good morning. I am Dr. J.B. Kanwar, Co-Organizing Secretary ESICON 2018. I am thankful to all the faculties who came to the ESICON 2018, international and national faculties. They have taken lots of time to prepare their slides, and they also have taken lots of time for traveling from different parts of the world, and even from national faculties they have taken 2-3 flights to come to Bhubaneswar, and with lots of difficulty they have come and shared their research and shared their experiences with us and with all the delegates. I am also thankful to the delegates of ESICON 2018. As you know, they are the spine of all the conferences. I am thankful to them for attending in very large amount, in large numbers. So they are keeping all the halls full, and they have been very interactive audiences, having a fruitful and extravagant ESICON 2018. I am also, you know, that any conference of this magnitude would not have been possible without the sponsors of the sponsors, and we are delighted to have large number of sponsors from different corporate houses from India and MNCs. And also I am thankful to the Mayfair staff, as all the delegates and the faculties who have come from different parts of India and abroad, they have all enjoyed the amenities, the ambience and the hospitality of the Mayfair people. I am thankful to the Mayfair people, and also I am thankful to the team ESICON. These are the people who have been working for last one and a half years, day in and day out, and have been planning everything tit by tit, and so that to make this first conference a successful one. And probably I expect and I hope we are able to give you an extravagant ESICON 2018. Thank you.
At the end, I think we must thank the ESICON TV for capturing all of us and all the national and international faculties, and it's a big platform to share their views with all the delegates who have attended. Thank you, ESICON TV.
And another important thing is, most probably ESICON TV is one of the newer initiative what we have started this year, and definitely through this ESICON TV, everybody will reach in international panel podium through this ESICON TV. Everybody can give their message also through this ESICON TV, and I am also thankful to ESICON TV for this part, and I am thankful to whole my team, not only the team and in which all our organizing committee, which includes all our endocrinologists from Odisha, is a part of our team, and I am thankful to all my core committee members who have stood behind me throughout the year. Thank you. Jai Ho. Jai Ho.
Thank you, ESICON TV.
Thank you.